What is diabetes? Is it simply about managing your diet and reducing the amount of sugar you eat? In this first video, we'll learn about what causes diabetes and why it can actually have a huge impact on quality of life and even lead to death. Hey everyone, my name is Dr. Graham Dersnah. Welcome to Bite Size Medicine, your go-to channel for short, easy to understand videos about the common medical topics that matter to you. If you're new, make sure to subscribe, get involved in the comments, and check out the description below for links and resources. Let's get started. According to the 2020 National Diabetes Statistics Report by the CDC, 34.2 million people in the United States have diabetes. That's 10.5% of the population, or 1 in every 10 people. So diabetes is a very common disease, and since there's a lot of information to cover, it's going to take us a couple bites to get through. This video will explain what causes it and why it's important to manage it if you have it. There are actually 3 types of diabetes: type 1, type 2, and gestational diabetes, which means diabetes that occurs while pregnant. I won't be addressing gestational diabetes in this video, but let me know in the comments if you want a video specifically about it. All types of diabetes relate to how our body manages sugar. When we eat something, we digest it, then absorb the nutrients into our blood, so the nutrients can go to wherever they're needed in our body. One of the nutrients is called glucose, which is a type of sugar, and all of our cells use it for energy. Normally, one of our organs called the pancreas recognizes when we have a lot of glucose in our blood and releases insulin. The insulin tells our cells to take the glucose from our blood and use it. Once they use the glucose, the pancreas stops releasing insulin. So you can think of it like balancing scales. When glucose goes up, insulin goes up, so our cells know to use the glucose. Once the glucose is used and goes down, the insulin goes back down. So what causes diabetes? In type 1, which typically occurs in children, the pancreas is not able to make insulin. The reason this happens, and why it typically occurs in children, is because their body believes there is a problem with the pancreas and starts attacking it. This is called an autoimmune disease, and those types of diseases usually start in childhood. In type 2, which typically occurs in adults, but has been occurring more often in children in recent years, there is so much glucose in the blood that the cells basically ignore the insulin. This is called insulin resistance. The reason type 2 typically occurs in adults is because it depends on factors like diet, weight, and exercise, which takes time to affect our bodies. But it has been gradually occurring in younger children. So why is this so serious? In both cases, the glucose stays in the blood and is not used by the cells. This doesn't sound too bad, but it eventually causes several negative effects. Without the insulin to tell our cells about the glucose, whether we don't have insulin in type 1 or our cells aren't listening to it in type 2, our body thinks it's starving. To try and fix this, another organ, our liver, makes glucose by breaking down fat and protein. This adds even more glucose to our blood, but it still isn't recognized. We can get rid of some of the glucose in our urine, but when we do that, the glucose kind of pairs up with water and other nutrients and takes them with it, which causes us to urinate more often, and we get dehydrated and thirsty, so we're constantly drinking water. Because there is so much glucose in the blood, there are 5 major issues that can occur. First, the glucose can get stuck in our blood vessels and act like little blockages, making it hard for blood to flow. Without blood flow to our heart, we get a heart attack. Without blood flow to our brain, we get a stroke. Both can cause death. Second, it can go to our kidneys and cause them to fail. Third, it can go to our eyes and lead to blindness. Fourth, it can kill our nerves, which is actually a problem of reduced blood flow. This usually starts in the feet and can lead to numbness, tingling, and burning pain. Fifth, it can eventually require an amputation. The reason this occurs is due to a combination of having less blood flow and the nerve damage. So someone injures their foot, but they don't feel it because of the nerve damage. That injury can't heal very well because of the poor blood flow. Therefore, the injury gets worse, most likely gets infected, and eventually the only way to treat it is to amputate. Thankfully, diabetes has been researched extensively, and there are several treatment options if you have it, and several known factors that lead to diabetes that can be managed to prevent it. If you feel that you're experiencing any combination of these symptoms, 1. Urinating a lot, 2. Always thirsty, 3. Losing weight even when you eat a lot, 4. Changes in your eyesight, 5. Losing feeling or having tingling and burning pain in your feet and hands, 6. Having injuries that don't heal quickly, then you may want to visit your doctor and discuss the possibility of diabetes. Our next bite into diabetes will discuss the factors related to type 2 diabetes and how to manage them. Before you go, make sure to like, subscribe, and leave a comment. Let me know if you enjoyed the video, learned something new, have any questions, have a personal experience in this area that you'd like to share, or ideas for a future video. Thanks for joining me, and I'll see you next time for another delicious bite of medicine.